When we talk about zero harm, we usually picture physical tools like harnesses and hard hats. However, tracking physical accidents doesn't account for non-physical workplace trauma. If a safety initiative ignores these invisible risks, it cannot achieve true safety. These are psychosocial hazards. Burnout, chronic stress, and harassment are systemic risks rooted in how work is designed and managed. They damage human lives and cost organizations billions in lost productivity. To address them, we need to move past reactive resilience programs. We must build a proactive, structural, psychosocial risk management system. These hazards hide in plain sight during normal daily operations. We look for unrealistic deadlines that force constant overtime and role ambiguity where workers lack clear direction or resources. Organizations often fail to control these risks because they confuse psychological safety with psychosocial safety. Psychological safety describes team dynamics, whether people feel comfortable speaking up without being punished. Psychosocial safety is an organizational duty. It is a legal obligation to prevent systemic harm. Treating mental safety as a social nicety leaves an organization legally exposed. When treated as a structural obligation, it fulfills the duty of care and protects the workforce from preventable injury. We manage these invisible hazards by mapping them onto a tool safety professionals already use, the hierarchy of controls. At the top of the chart is elimination. In a psychosocial context, this means redesigning a job to remove toxic task demands. If a workflow requires 60 hours a week to complete, we change the workflow so the tasks fit into 40. Next are substitution and engineering controls. Here, we replace outdated manual processes with automated systems to reduce cognitive overload and repetitive stress. Below that, we have administrative controls. This involves changing how people work by enforcing strict shift limits and providing clear written job descriptions. At the very bottom is PPE, personal protective equipment. For the mind, this acts as mental armor. Examples include resilience training, mindfulness resources, or employee assistance programs. PPE is the least effective control. Resilience training cannot protect a worker if the organization ignores the systemic hazards in the upper tiers. Implementing these controls satisfies the compliance requirements of ISO 45003. Specifically, it aligns with Clause 6 for planning and Clause 8 for operational safety. This hierarchy embeds psychological health into operational safety. It establishes mental well-being as a measurable, enforceable standard for every department. Effective control requires strict structural accountability across the entire organization. ISO 45003 outlines these duties. Under Clause 5, management is responsible for allocating resources, setting policy, and demonstrating a commitment to psychological health. Supervisors apply these policies daily. They monitor workloads, maintain strict confidentiality, and ensure workers can report concerns without fear of retaliation. Workers also play a role. They must actively participate in the system by identifying hazards on the ground and reporting them early. The standard highlights how work organization drives risk. Providing clear expectations and giving employees autonomy over their tasks directly lowers psychosocial risk levels. Structured accountability leads to measurable results, improved well-being, reduced absenteeism, and higher organizational resilience. Teams can implement this daily using a pre-task, during, and post-task well-being checklist. This tool turns a workload into a structured evaluation of mental readiness and resource availability. Clear roles ensure psychosocial safety is a shared operational habit rather than an isolated reaction to a crisis. Continuous monitoring ensures the control plan actually mitigates the hazards identified during planning. We track progress using validated tools like the Moslock Burnout Inventory and the COPSOC-3. These allow us to measure objective changes in emotional exhaustion and depersonalization over time. Is burnout a sign of an individual worker's weakness? False. Burnout is a systemic failure. It happens when an organization fails to balance job demands with the necessary resources. To maintain a safe environment, follow 3 core principles. Treat mental hazards like physical hazards. Design work to honor human limits, and manage risks proactively. Resilience is a choice to protect the mind as fiercely as the body. By building these controls into your operations, you fulfill the ultimate promise of safety. Everyone works safe, and everyone goes home safe.